to Vital Times, the California Society of Anesthesiologists podcast series. I'm Dr. Ludwig Lin, and today I am absolutely stoked to be able to chat with Dr. Jason Leong. Dr. Leong is currently a staff physician with Kaiser Northern California, and he is an intensive care specialist, a cardiac anesthesiologist, and to be totally transparent, somebody who I've known for years now. So I would like to welcome Dr. Leong. Thank you so much.
Thanks for having me.
The first thing we ask everybody is to make sure that we declare any potential conflicts of interest.
No, I have no conflicts of interest.
Okay, all right. Well, the reason we're talking today with Dr. Leong is because we've been discussing recently the origin stories and the purpose in life of various talented California anesthesiologists. And Dr. Jason Leong has a fascinating career. He started out as a registered nurse, and I'll let him tell the story, of course, but I know that he was the charge nurse for Kaiser Santa Clara's emergency department, and then pivoted and went to medical school at Albert Einstein. I know this because that's actually when I met Jason, and we did some really cool research together at Stanford University, which to this day remains one of my proudest moments. He then went to Stanford for a combined residency in anesthesiology and internal medicine, and then did 2 consecutive fellowships in cardiac anesthesia and critical care medicine. So I am actually shocked that Jason has not found some other fellowship to do training in. But I think it's really instructive for us to hear about the way Jason has chosen to navigate his career and whether he started out with a goal in mind or whether it was just like, one glorious adventure. So Jason, I'm just gonna let you start talking. How did you start out in your healthcare career, and how did you wind up where you are today?
Wow. Thanks for that intro. When you bring it all back, I kind of forget just how many experiences and, past lives I've had. As you said, I started out in nursing. From the very beginning, I have no family who are really in healthcare besides my mom, who's a clinical laboratory scientist. She worked at a lab in a local hospital, and she always came home with stories about, I heard these terms, GI bleeder, or, had a high risk pregnancy, and I didn't really know what to make of them, but they sounded interesting to me. I think at that time when I was graduating high school, which was in 2002, there was a big nursing shortage, and nursing kind of goes in waves. There's periods of big surplus, and then there's periods of shortage, and it was a period of shortage, and it sounded like a great career, especially in the Bay Area. California nurses, make pretty good money. So I decided, kind of at a whim, like, let me just check this out, get into healthcare, see what it's like. And I was very fortunate, got accepted to San Jose State. There was an accelerated nursing program, which was 18 months after you did your prerequisites. So I actually graduated from nursing school barely 21. And I was fortunate at that time. The Kaiser that I actually work at now, actually hired me as my first job straight into the emergency department. And one thing to know about nursing is that most nurses do a couple years in med surg before they're allowed to go into what are considered critical care areas, ICU, perioperative medicine, nursing, ED nursing. But I was lucky. I was able to go right into the emergency department. And there I just had what I still explain as my most formative years of my life. I think it taught me, like, you just end up bonding. And we know this as healthcare workers now that have been through med school, that have been through residency with other humans going the same path. But I bonded with this group of nurses who were actually all kind of young. I would say most of us were between 20 and 40 years old, but we all bonded really closely. In the ED, there's that sense that you're in the trenches together. You have this sense of common purpose, caring for these patients. And we're still, very young and idealistic, and it was a great time. It was a really great time. And at that time, I don't know if you were aware, Ludwig, but it was actually called the Kaiser Stanford Emergency Residency, and it was because the
Oh.
Stanford ED residents all rotated through Kaiser, and they still do. They still do, but now they've dropped the Kaiser part. It's just the Stanford Emergency Medicine Residency. But um, I got to meet just some, obviously very inspiring residents from all walks of life. And I think that's sort of, I was young again. I, graduated nurse school, like I said, barely 21. And I was just thinking, what's my next path?
Hmm.
What do I want to do next? I knew I wanted to do something.
Okay.
As you said, 2 years into bedside nursing, I was lucky enough to get a charge nurse position. It was night shift. The night shift positions are always a little bit easier to get, so I was able to squeeze myself in there. Um, and then that was a really, I think, kind of point where I was trying to figure out exactly what I wanted to do. Did I want to go to become like a more advanced practice nurse? Did I want to go into administration? And I think, especially as you go ahead in your bedside RN nursing career, if you don't become an advanced practice nurse,
Hmm.
many nurses find that you just get farther and farther away from the bedside. Once you become an A&M, an assistant nurse manager, a nurse manager, nursing director, you're almost completely away from the bedside, which is a little different than medicine. As just because you're a chief, a chair, you still can have a clinical practice. Nurses are pretty different that way. Once you become a house supervisor, you're not, on the wards, caring for patients yourself. So I found that I want to be at the bedside. So I sort of took that idea off. And then I was thinking, should I be an advanced practice nurse? And I met actually this really inspiring anesthesiologist. His name was Dr. Fisk. He was an anesthesiologist, critical care. And I think at that time he had just given up anesthesia completely and just did critical care.
Okay.
And that was around time when there was early goal directed therapy with sepsis and the reverse trial, and it was a really big thing. And so there was a lot of just kind of, especially as me, young and idealistic, there was a lot of draw toward critical care just because it was the hot new thing. And I remember at that time, everyone, if you had a lactate and you were hypotensive, you got a central line no matter what. Because you could measure the continuous SpO2. It sounds
Right.
barbaric now, but that was just kind of, but it was the new, right, hot thing. And I remember he came down to the ED a couple of times to admit almost everyone that was classified as sepsis like got admitted to the ICU at that time too, right? It was really
Right.
early, aggressive care, a lot of fluids up front, SpO2 monitoring, um, and just seeing him a lot down in the ICU. You know, he he probably doesn't remember me at all, but I remember, I met him once, was admitting one of his patients, and he turned to me and said, "Why don't you just go to med school? You should go to med school." Like it was very like, you should go to med school, and I never thought about it. Never thought about it at all. Um, I was definitely actually going to apply to UCSF's acute care nurse practitioner program.
Oh,
That was
okay.
actually what I was initially thinking. UCSF,
Hmm.
as you know, has a great nursing school. Um, but thought about it a bit. And, you know, like I said, there was a lot of people around my age, and told one of my close friends, and she was like, I thought about going to med school too. And it just kind of came out. And I think over the next 6 months, we sort of talked about it. Both of us did. And then another nurse who joined also started to talk to us about going to med school. And I, at that time, decided to take a leap and just do it. So I started doing prereqs. I was again doing night shift. Best training for residency ever. I literally worked from 7 p.m. to 7 a.m. And then I went to school from 9 in the morning till about 1 p.m. during the day. And then sometimes I'd have labs during the day and then I'd go back to work at 7. Like
Wow.
it was, but like, it was probably one of the hardest times in my life, but it
Right?
also made residency, I was like, I've done this before. It's always a little painful, but I was like, I've done this before. Um, but and anyway, so I started, and then actually the other two that I talked about that were also considering going into med school, all followed suit. And to this day, everyone, one of them's an ED doctor at Kaiser as well, and another one is a cardiac anesthesiologist in Arizona.
Oh, that
So
is so cool.
it's kind of cool how it all worked out.
Yes, but
Um,
I think that group support uh, is probably what got you guys all to do to accomplish that goal.
yeah,
Yeah, so I
and
love
verbalizing.
that.
I think verbalizing your goal and actually saying it out loud
Mm,
is, being like, I'm going to do this, and actually telling someone else kind
right.
of hold yourself accountable. It is kind of scary, I would say, especially when, there's another path which can lead to just as fulfilling career like a nurse practitioner, but it's a shorter amount of time. You know, I don't have to go back and redo prereqs. I'm not going to have to do a big residency. Um, but verbalizing the reasons why we decided to do it, which really I think we all wanted, really just the most in-depth knowledge we could get, the best training experiences we can get, um, verbalizing it to each other, and then actually verbalizing our goal really helped us push
Yeah.
forward. Yeah, I
Yes.
got lucky. I got in my first round, but I know that some of um, my colleagues didn't get in their first round of med school. But just encouraging each other, and everyone
Right.
ended up doing amazing, doing absolutely amazing.
Well, that's a really good point. I mean, the group support probably really worked during that period
Yeah,
because having each other's backs, but also them knowing that you made it, it
yeah.
made it an attainable goal, right? So I think that's great. That's an awesome story right there. But we haven't even started because I have so many more questions.
No, no.
Well, you stuck to your guns. You were inspired by an anesthesiologist. I think that is so fun, and you wound up going into anesthesiology. Did you have any doubts during medical school, or was it sort of like that's what I want to do and I'm going to do it?
It's funny. Some of my med school classmates, they knew that I was sort of just had a mindset to do anesthesia.
Hmm.
As you mentioned in your intro of me, I actually did an internal medicine residency as well. That was
Hmm.
not part of the plan. But I found I went through med school and I actually enjoyed every rotation. I
Hmm.
really did. I knew some rotations, some specialties just weren't for me. Radiology was the classic one. I remember being in the dark room for so long, I started getting tired. Um, it's also probably why I shouldn't be in a dark OR, because after a while, like my eyelids start to droop a little bit. Um, but I enjoyed it all, like, and I appreciated it for what it was. And I think deciding to do critical care and thinking about critical care and, what sort of career I eventually wanted, internal medicine just made the most sense to me. You know, I tell everybody, can you be a great intensivist without doing internal medicine? Absolutely. Absolutely, you can. I think it did make my critical care training. Um, I was able to really embrace all aspects of our critical care training. As you know, I did critical care at Stanford, and it's a multidisciplinary. You do MICU, you do SICU, you do CVICU. So you do get exposure to oncologic emergencies, like all sorts of things. And having that internal medicine background just made me a little bit more at home with some of these conditions that I saw during fellowship.
Absolutely.
And I had an amazing time in fellowship. But um, now in my current practice, though, I have kind of niched down and actually not do I only do cardiac ICU now. Uh, but I do miss the internal medicine part of it for sure.
Internal medicine's great. For example, love nephrology. And I always feel like, that's like an extra level of geekdom, not to diss them or anything, but to like obsess about like, like renal lights or something. But
Oh,
I mean urine lights. But I think that is something that is really wonderful about critical care is that you need to be good in all these different disciplines and then you need to bring it to your work. And yes, you say that you're in the cardiac ICU, but internal medicine happens in those patients. So I'm sure
Yeah.
you have to like bring it out every now and then. So I'm sure it's challenging. Um, I wanted to follow up and ask you, now that you've been through all of this, what are some of the pluses and the minuses of the different types of uh, careers and jobs that you've had? So you were a emergency room bedside nurse, you were a charge nurse in the emergency room, you were in internal medicine, you were in the ICU anesthesia. So did you have any like opinions about any of that?
Yeah, I mean, I think big picture, just really, really big picture. And I don't know if you know this, or I don't know if I told you this, but actually, my stepdaughter is actually a nurse, and she is a ED nurse as well, and kind of, and yeah, she's amazing. So and I've had this conversation with her. I've had this
Uh-huh.
conversation with other people, but I think big picture, some things that people don't realize as much, especially when they're a nurse. And nurse, you're really engrossed in healthcare. You see physicians day to day. A lot of them become your friends just by you seeing them and working with them every single day. But I do find being a physician is a little bit more lonely, and I mean it in a way of as an especially in an ICU as a nurse or in the ED as a nurse, when a patient's crashing, every nurse jumps in and kind of everyone takes a shared responsibility for that patient. As a physician, especially I have amazing colleagues. They're always there to come help, to give guidance, but you never really lose that sense of responsibility for that patient that was under your care, and shoulder that burden sort of alone in a lot of ways. Um, when a patient doesn't do well overnight in the ICU, and you kind of think in your head, was there something I missed? Should I have been more aggressive about this? Should I put them on CRT earlier? Right? Even if you have a lot of colleagues who gave their 2 cents about it, came and helped you out, you still feel that responsibility kind of squarely on your shoulders, you know,
Yes.
which is a little bit different than I find nursing was for me.
Mhm.
Um, Another thing that I tell nurses is you're not going to have as much control likely over your schedule and job situation. And what I mean by that is in medicine, usually you can either kind of choose that career that really works with your schedule, but you might not get everything you want out of it. Um, for instance, you only want Monday through Fridays, you know, 9 to 5. You might end up, choosing a job that's just purely outpatient, you know, sort of anesthesia practice. Versus in nursing, you could really find if you want to do critical care, you could do an ICU shift from 9 to 5. They'll never make you work nights. If you want to do a clinic nurse, you can find a 9 to 5 there. So you could have both the schedule and the job, which I find in medicine is just not as common, especially if you don't want to take call, if you don't want to work nights, it does limit the jobs that you are available to you. So there's a little bit more of a limiting factor there. Um, but on the plus side, I think in medicine you have a little bit more autonomy, which is something that I really valued, something that I didn't even really realize until I became a physician. And I mean that as a nurse, you practice within your scope, especially if you're like an inpatient nurse. The orders that are given to you are the orders that are given to you. You know, you may not agree with the orders, and that I think is at that time a collaborative discussion is important. But in the end, it's not your autonomous decision of what's going to happen, or even if you may think differently of what's the right decision.
Mhm.
Where as a physician, um, you have the autonomous decision, but you also bear the responsibility of what happens with that decision. And I enjoy that. I enjoy that responsibility. I think it makes me constantly be on my toes and think, am I doing the right thing? Is it time to change course? Especially in the ICU, as you know, Ludwig, you have a plan, but you all should be ready to do a 180 if your plan doesn't work out the way you think it will. I mean, anesthesia is the same way too. If your anesthetic isn't working, you have to change your anesthetic.
Right.
Period. Right. But I enjoy that ability to be able to make those judgment calls myself, which I think is a really plus for medicine. Um, you know, I think, as I said before, in nursing, as you go on in your career, a lot of times, if you want to advance, you get farther and farther away from the bedside. So that's a minus. Um, but at the same time, I say this a lot. Nurses run the hospital, right? They control bed control. You know, we care for the patients with the nurses, but the nurses truly, uh, run the operative side of the hospital, the operative side.
It's true.
And and some people just love that. I have another one of my coworkers at that time who had just graduated nursing school a year before me, and she was kind of a young mentor, but she was just 2 years older than me. But we knew she was going to go far. She ended up becoming the regional director for all the emergency departments around Northern California, and now she's really high up in the Kaiser organization. And so, from that standpoint, some people really thrive off that. And I know she doesn't do any more bedside nursing, but she
Hmm.
contributes obviously in a different way, and
Right.
just as valuable way.
Well, we all have different talents. So
Yeah.
it sounds like that's how she's contributing. In hindsight, would you have done any of this differently?
No, I don't think so. I think, I mean, I'm so grateful for the job I have right now. I truly feel like it's a unicorn, and I'm in touch with many of the people I trained with. And
Hmm.
even to this day, to find a job that really is split cardiac and cardiac ICU, and there's pluses and minuses. Again, just like I told you in med school, I loved every rotation I had. In anesthesia, I loved every rotation I did. I loved OB, I loved peds, I loved regional. Even actually during my cardiac fellowship, we have 2 elective months, and one of those months I just did pure regional because I loved regional just so much. I just love doing it. It is actually part of my practice. Not a ton, but we do some regional for
Awesome.
patients. Um, but I ended up deciding I had to decide if I was gonna really just go into very niche practice, which really, like, the sort of only cardiac ICU jobs, as probably most listeners are aware, are really only in academics. It's really hard to find a private practice job where you are split 50-50, and they're really just looking for a cardiac intensivist, a cardiac anesthesiologist. And coming out of training, I felt if I really wanted to have mastery over a certain field, I had to
Hmm.
make that decision if I was going to try to be a jack of all trades or if I was really going to just kind of go down the cardiac route. And I chose the cardiac route. You know, I have no regrets. Would I have been just as happy doing, some general stuff, some OB, some cardiac, maybe a little bit ICU? I probably would have. But this is the life I chose, and it worked out great. And so I'm not gonna look back.
That's awesome. I think that says tons. Okay, so the next question I want to ask you about this is I think a lot of people in healthcare are going to be curious since you have a background as both a very successful nurse and now as a very, very successful, uh, highly specialized anesthesiologist. How do you think your medical school and subsequent training, how did that add to you as a healthcare professional, and how did that change the the tasks that you do now in healthcare? I mean, I think you've answered some of this, but I wanted to make this a explicit question.
Yeah, I think I'm gonna narrow down that question just a little bit.
Sure,
I've
please.
definitely asked, you know, does being a nurse or does being a respiratory therapist? I've talked to respiratory therapists who went to med school. Um, does being and I've actually known a CRNA that ended up going to med school. Like, how does that actually affect me as a med student, as a trainee? And what I find is, I think you still have to learn the basic sciences like everybody else. Like, you still have to hit the books, still a lot of material, but you have a way to relate to the material that some of your classmates do not have. Very easy, like, idea is when you're thinking about ischemic heart disease, right? An NSTEMI, a STEMI. If you've worked in a hospital as an ICU nurse, you actually like that. A patient actually pops up in your mind, and you remember, oh yeah, wait, I remember getting the EKG. I remember seeing the ST elevations. I remember calling the cath lab. I remember the different anticoagulants, antiplatelets we used, maybe even TNKs or, thrombolytics that we used if we didn't have a cath lab right away. So you have a way to learn the material with a framework. I think that keeps the material a little bit more relevant versus people who haven't had those healthcare experiences. Um, and it made learning the material, I don't want to say easier, but I could connect the dots a lot quicker um, than some of my other classmates who were way more brilliant than I was. But they just didn't have the experience, right? Like, if you just don't have that relatable experience, it just takes, I think, a little bit longer for you to connect the dots to see the bigger picture of
Right.
treatment plans and stuff like that. I think in residency, probably definitely helped me the first couple years, but then after that, it kind of levels out a bit. Um, the first couple years, it definitely helped. I did find that it actually helped me relate to nurses a lot, and I don't know whether nurses were just nicer to me once they found out I was a nurse. It was not something I advertised right away, but there wasn't many interns that could start an IV on almost anything, and
Oh
that
my
was
gosh,
that
so
was my
true.
claim to fame, was
Right.
starting IVs when I was an ED nurse. And so, and I missed it. I missed it in med school. I like missed starting IVs. I don't know why. It's a really weird thing. Um, and I was actually really good at putting Foley's in. And I remember um, one time, one of my attendings, I was a CA1, and they had to put a Foley in this patient, and the nurse was busy. And I was like, I'll just do it. Like, let's just get this case started. Like, let's just put the Foley. And she was blown away because it's motor memory. I mean, it's one of those things that's like riding a bike. You never really forget how to do it. And like, it's small stuff. It's just, you like know how to inflate the balloon. You know how to keep one hand sterile while the other hand gets
Right.
like, it was just motor memory. And I just put it in. I remember she's like, "This is the most amazing thing ever," and I was like, "It's not." But so like you have things that hint you that you were in healthcare before, but
Right.
honestly, the skill acquisition, the knowledge acquisition is just the same, especially once you get farther out in your training. Um,
Hmm.
you know, especially I was surrounded by brilliant co-residents,
Mm.
um, and so we all learned from each other and each other's experiences.
Ah, that's good to hear. Well, to add to this question, so you've talked about how having been a nurse made certain aspects of medical school and training easier. Thinking back to when you were practicing as a bedside nurse, what are some of the things that you do now that you wouldn't have done before as a nurse? If that makes any sense as a question.
Sorry, can you reframe that one more time?
Yeah, maybe let me try to reframe it. So, I mean, obviously, anesthesiologists and bedside nurses do different things, but what are some of the things that you do now that ha- uh, that you wouldn't have thought about as a bedside nurse?
Yeah, I think, and this is something that, as you probably are aware, anesthesia trainees, some people develop, some people don't. Um, but especially, again, the Manny Rivers sort of era, you know, doing drips and stuff like that. Organization, my workstation, I have the way it's set up always. And I think that's a very nursing thing. I remember in our code room in the ED, we always had one place where we'd put out all the lab tubes. Everyone gets a rainbow lab draw, right? So you have your IV set up here, you have your lab draws here. You had, if they were coming in septic, there was one person that was putting a Foley in because you were getting a UA no matter what, like send off the urine. So that sense of organization and organizing my workspace is always something that has stayed with me, especially in cardiac. As you know, our lines can get quite messy because you're in drips. Um, and I think that organization, I will say the one thing that I don't recognize, but I am told, is that the way I relate to nurses, it's obvious that I was a nurse before. And I have never really understood that comment before, but it has been told to me multiple times. Um,
Interesting. Well, I think communication is so important, and it's very much a two-way street. So it sounds like, you know, you exude that, which is nice. So, kudos. And I think that is sort of enlightening to the rest of people listening to this. That whole sense of empathy and
the
communication.
one nurse told me it's because I explain my reasoning every single time. Um, and I do find I do that, especially when a nurse asks for something and I'm like, I either say, I don't think we should do that because of X, Y, and Z versus just no. Um, or if I think we need to change plans, I'll kind of be like, this is what I was hoping by going down this pathway we would achieve, but we're not achieving this. And this is why we're going to switch plans. And this is the new plan and blah, blah, blah.
Cool. That's a good tip. I like that. Okay, so another question for you to get you to compare the different phases of your healthcare career. What brings you joy in what you do now professionally, and do you think that changed over the course of your career during its different phases?
Oh, yeah. Good question. I've only recently actually reflected on this. Um, I think definitely in med school, I was blown away by the depth of knowledge and trying to understand why we do what we do as physicians, the evidence behind what we do sometimes versus sometimes there's no evidence behind it, but we either A, just have had anecdotal evidence that it works and we've seen it work for ourselves, so we continue to do it. I think evidence-based medicine obviously was a really big, it still is a really big field, and it's something that we're constantly progressing. And as you know, the evidence changes. It sometimes cycles. Something that was not evidence-based, maybe there was some truth to it, but there wasn't. But that was a lot of med school, and I think early residency. I think mid residency really became, what is my theory on practice, what type of practitioner am I? And I've actually found I'm a very conservative practitioner. I like to do the same thing the same way every time. And we get fellows at Stanford, and I think this is a great fellow level conversation to have. The reason why I do that, and I'm not saying it's the right way to do it, I'm just saying the way it works for me, is because when I run into trouble, I know how I've done it, so I could troubleshoot it in a very systematic way. Um, versus I actually have colleagues who, do it a little bit different every month, and they like that variety of practice. I have one colleague that will sometimes put in subclavian lines just because he hasn't done it in a while. Where I, I just do the same thing every single time, very consistent. And I actually found joy in that. I actually found they call it, I think, flow sometimes, where you're just kind of in the moment and you're flowing with it. You're so
Oh,
focused on it that I can be having a side conversation at the same time, but in some part of my brain is 100% dedicated to what I'm doing.
yeah.
But I have that sense of flow, especially with the start of a cardiac case. And that brought me joy. And I think the sense in mid-residency fellowship, the sense of getting competency and starting to master some things, especially toward the end of fellowship, really brought me a lot of joy. And then now I've just finished my fourth year out, starting my fifth year as an attending. It's the people around me that actually bring me a lot of joy. And
Mm,
I've found a really special group of colleagues. And to be honest, if they told me I had to give up cardiac and critical care, but I would stay with this group of colleagues and we would be doing something else, I don't know, whatever, I'd be totally up for the adventure. Like the people around me, the support I have, you know, it values. I think it matters a lot more to me now than it did earlier on, even in my early attending career, even in residency per se. But in residency, I mean, I was just surrounded by such brilliant people. It was hard to really appreciate that until we saw where everyone went and how everyone
mm-hmm,
kind of grew.
mm-hmm. That's beautiful. I love it. I think having a group of people that you really get along with, that's what creates a sustainable career, which is something that I try to discuss in these podcast interviews. So I love it that you found that. And I think that's so important and so fortunate for you. So kudos. And I think, kudos to the organization actually for for creating that environment and making it possible. So that's great. I'd like to make sure that I ask you this question before we finish up. Any advice that you would give to folks in similar situations and you know thinking about how to navigate all of these possible paths?
And I'm going to narrow that one down to like if I was talking to a nurse who was trying to figure out what they wanted to do, or someone else in healthcare in general.
Sure.
I think um, what I tell, especially nurses, because nurses, there's a lot of options out there, and I think this kind of dips into what we talked about earlier, pros and cons. Um, but nurses can have really great, fulfilling careers as a nurse practitioner, as a CRNA, and the time for training and the financial investment in medicine is greater than a lot of those other options that nurses have. But at the same time, what I tell people is that if you really want the most in-depth amount of knowledge, the most in-depth training, kind of down that idealistic sort of path I was when I was a nurse, there's really not much replacement for med school. Um, but it is a sacrifice. It is a big sacrifice. It's a sacrifice to your personal life. As many people know who are applying to med school, I'm pretty sure it's similar to when I was applied. You just apply and you kind of go wherever you go. You don't get to choose the location always. And then after you do that, residency is the same way. You apply to residency, you just go where you can go. So you do lose control of some of your life for a substantial amount of years. So I don't want to minimize that either, but it is also extremely fulfilling. But you know, you can only think about it so much. I do find that some people really go back and forth, and at some point, you're never going to have the perfect answer. You never have the perfect answer to this is the right thing for my career, and I'm going to do it. But you just have to take what you know about yourself, what you know about your options are, make a decision, and just go for it and don't look back. Yeah.
That kind of sounds like ICU and anesthesia. You make your best guess, right? But you know what? Thank you for telling people that. I think coming from somebody who has experienced different ways of being a healthcare professional, I think that's really insightful. So thank you for that. And then my last question for you before we wrap up: is there anything that we have not covered yet that you really want to leave with our audience?
No, I think one thing I would say is you never know who's going to be around you that you may inspire, and you may never know it. Um, I have a couple stories. One of my colleagues, he was a young attending when I was a nurse, and I've never told him this. But I remember there was a crashing patient, and he flew down, had to do an awake central line, which none of, especially as an anesthesia, we never like having to do an awake central line, right? But just spoke so calmly, was so competent. It just left the biggest lasting impression on me. And then there was another colleague who was a resident at Stanford who ended up being a chief resident and then also did some per diem work with us. And he was just the kindest person. He unfortunately just recently passed away.
Oh my gosh.
But he just always, I remember he had the temperament that I always, you know, you can never not get frustrated sometimes, right? You're always going to have a moment of frustration. Sometimes it's with yourself. Sometimes it's with the situation. Sometimes it's with an interaction you have with someone else. But how you handle that frustration um, is important. And I always took it away from him. I remember there was a very angry patient in him. And this is the hard part about the ED, right? No one's happy to be in the ED. Like, not that people are happy to be in the ICU, but it's a little bit, there's not that like tension that there is in the ED sometimes. I remember there was just a patient that was just screaming and laying into him. And, as a chargist, I'm like, oh, should I call security right now? And he just was so calm, empathetic, diffused the situation. And I've always remembered that.
Mm-hmm.
Him
Cool.
passing was definitely a great loss. But
Yeah. Oh, that's tragic. Well, you talking about this, I find inspiring because what you're saying is that you found inspiration in different places and you've allowed it to happen. But also there are these people out there walking the corridors doing really good work
Mhm.
who inspire people like you. So I think that's wonderful, and it's a wonderful message to all of our listeners. So thank you for that, Jason.
Oh, this is fun.
Well, unfortunately, it is time to wrap this up. I would encourage anybody who is more curious about Dr. Leong to reach out to us, and we will put you in touch. But I'm going to take this opportunity to wrap up this incredible conversation and thank Dr. Leong again for taking time to do this. I mean, I've always known that he was a pretty awesome guy, but I think this definitely cements that. And I really want to be able to share his journey, his different experiences, which I think highlight the different possibilities that are available in healthcare. So for the California Society of Anesthesiologists podcast series Vital Times, I'm Dr. Ludwig Lin, and thank you for listening. Take care.